y'all, it's Deja, and welcome back to Unheard-On the Pink Mic, a podcast where we talk about the people left out of conversations that matter most, especially healthcare. Today I want to talk about something that matters most, to ourselves, to our families, and to our future, the racial disparities in clinical trials.
Wait, what is a clinical trial? Before we go deeper, let's break this down. Basically, a clinical trial is a research study where scientists test a medical treatment, like a new drug, vaccine, or a therapy, on people to see if it's safe and if it works. There are usually multiple phases. First, they test for safety in a small group, then they check how well it works in a bigger group, and finally they compare it to what's already being used currently. These trials are how medications go from the lab to your local pharmacy. But if the people in those studies don't reflect the people who will be taking the drug, the results might not be reliable for all of us. The past isn't past. When we talk about medical mistrust, we have to go back, because this didn't just start yesterday. I'm going to talk to you today about the Tuskegee Syphilis Study. Between 1932 and 1972, hundreds of black men with syphilis were observed by the U.S. Public Health Service but never treated. Even when penicillin became the standard cure, doctors deliberately withheld treatment just to watch what would happen. This wasn't hundreds of years ago. Some of these men were still alive in the 90s. That kind of betrayal just doesn't disappear. It stays in families, in communities. It creates this deep mistrust of the healthcare system, especially research. And honestly, I get it. This is why Black people are scared to go to clinical trials now, even when they're in their area. Rarely. The system still isn't built for us. Fast forward to today, and the numbers still tell a disturbing story. The FDA reported in 2020 that 75% of clinical trial participants were white. Only 8% were Black, even though we make up 13% of the US population. That's not just a gap, that's a red flag. People say, well, trials are open to everyone, but are they really? Think about it. What if you don't live near a hospital running a study? What if there's no transportation? What if the study info isn't in your language? Or it's full of medical terms nobody understands? Karen Allison and her co-researchers found that minorities often want to join trials, but they're blocked by stuff like logistics, lack of info, and mistrust. The consequences are real. Here's where it gets scary. When drugs are tested mostly on white people, the results may not apply to other racial groups. There was a study by Shui and others about treatments for psoriatic arthritis. Most of the people tested were white, but the disease doesn't affect all races the same, and neither do the treatments. If the trials don't include us and the meds do not work for us, or worse, cause us harm, what are we to do? And without solid race and ethnicity data being reported in studies, like the Turner et al. Pointed out in 2022, we can't even track how bad the problem is. That is dangerous. I don't just want you to have my opinion on this. So to help me talk more about this, I want to bring in my good friend, Savannah. She's a future medical student just like me, and she understands how important clinical trials are to minorities in America and all over the world. So please give it up for my good friend, Sav.
Hello, everyone.
How are you today?
I'm doing wonderful. My name is Savannah McBride. I am an aspiring pre-medical student. I'm a biology major, double minor in chemistry and psychology on the pre-med track, and I am an aspiring epidemiologist.
So, have you ever heard about the Tuskegee Study before, and what was your reaction when you heard about it?
I have heard about the Tuskegee Study. You know, they subjected Black people to such demeaning trials, and just the lack of information, the lack of informed consent. You know, it is one of the biggest cases that people talk about, and I just find it to be outrageous that they treat us like that. And now going forward in 2025, there's still a lack of representation for Black individuals.
Exactly. Do you think people in our community would trust clinical trials? Why or why not?
I believe there's a lack of trust on clinical trials, especially within the Black community, due to the fact that there's a lack of knowledge.
Yeah.
I feel like Black individuals are not aware of the fact that clinical trials even exist, what they are, how they benefit science, and how they benefit medicine. And I personally feel like also with the stigmas around Black people and mental health, I feel like it will be difficult for people to open up to the ideas of clinical trials.
Exactly.
Because in Black families, it's such a burdensome topic to talk about medical issues and mental health and the things that surround those issues and why they come about.
Okay, last question I have for you. If you had the chance to join a study that could help people of color, would you do it, and what would you need to feel comfortable?
Absolutely. If I had the opportunity to join a clinical trial, I absolutely would. As a student that is really dedicated to medicine and developments in science, contributing to the development in science, I feel like that is wonderful, and that is something I truly do want to take part of. And what I need to be to feel comfortable? Informed consent, period. Informed consent, it is so important. The knowledge of what's going on in the clinical trial, what's being tested, what I'm doing, how long I'm going to be doing it, the proper information, the proper tools, and information, I feel like I would totally be open to a clinical trial. Thank you so much for that question.
Of course. So, Sav, I want to say thank you so much for answering these questions. I love you.
You know what? I'm so happy to be here. This is wonderful, and I'm so happy that you've opened me up to this opportunity.
Absolutely. At the end of the day, clinical trials are supposed to push medicine forward, but how can we move forward if whole communities are being left behind? This matters to me because it's not just statistics, it's real people. My family, my neighbors, your family, your neighbors. People who deserve care that actually works for them. Fixing this means making research more inclusive, from who's getting recruited to how we talk about medicine. Because if we want personalized medicine, we need to make sure everyone's personhood is a part of the process. Thank you to listening to Unheard on the Pink Mic. I'm Randasia, and I hope you'll be asking questions, speaking up, and making space for every voice in the